Hi.
Hi.
How are you?
Good. Great to be here. How are you doing?
Good. So we'll just jump right into things.
Ah,
And thank you everybody for tuning in right now. I'm Dr. Kat Powell, a mobile physical therapist here on Long Island. And today we have Dr. Dawn, a naturopathic doctor. And I'll let you take it away and tell us about yourself, how you got into the profession, and who you treat.
sure. Yeah, so I'm Dr. Dawn. My last name is Siglane, but it's typically very difficult to say. So Dr. Dawn is much easier. I have a nice picture of a sunrise in my office, so you go with what you're given. So I go with my name. So Dr. Dawn. I'm a naturopathic doctor. I'm also a licensed acupuncturist and Reiki practitioner. I'm mainly based in Huntington, New York. I grew up in Huntington, actually.
Nice.
Yeah, so it's nice to be back. It's been a long time, actually. So I moved back after med school. I was in med school in Connecticut.
Okay.
Before that, I lived a few other places too, including San Diego. But it was nice my heart was calling me home. So back in my hometown practicing, very grateful that there was this wonderful practice. Inner Source Health is where I'm at. And they're right in the heart of Huntington Village, and they had been there for over they've been around for 15 years. They started in Manhattan, and then they've been in Huntington for over a decade now. So I knew about them before med school.
Oh wow.
Yeah.
So like full circle.
Totally. Meant to be. So it was really nice. And then we also have an office in Manhattan, so it's 1 block away from Penn Station.
That's convenient.
Yeah, so it makes it convenient. Anyone, sometimes family members, a mom or dad, they might be working in the city. Their family is in Long Island. So, it makes sense. Or I'll see patients in Manhattan and Long Island. So, it's nice to have that convenience. Yeah, so yeah, and I also have my master's in Chinese medicine. So I practice acupuncture, which I love. So I'm able to combine the Western medicine with naturopathic medicine and Eastern medicine, which is great. So doing tongue and pulse diagnoses really helps to bring it together. So
interesting.
Yeah, so whether people want the acupuncture or not, sometimes I'll ask to just assess the tongue because it gives me so much information.
Yeah.
So they don't have to get the full acupuncture treatment, but it's that other piece of the puzzle that really brings it together. There's a lot of insight that I can get through that, which is nice. And then also a Reiki practitioner. So if people are open to that. Some people don't even know what it is. So I love explaining that, doing talks about energy medicine. But so only if someone's open to that will, I offer that, and incorporate that for a treatment for them for Reiki. So, and that's using the chakra system. So using both the Western medicine with naturopathic, the Eastern, and then also being able to incorporate energy medicine is a really lovely way that I'm able to offer healing for patients, and I really do love it.
That's awesome. And it all helps a ton. I remember during PT school, I think we were going over an Ayurveda specialist and that they too look at the tongue. So we didn't really get to learn. We knew it was important and it can tell you a lot, but that's not our, forte. We leave it to you guys. What's like one interesting thing about looking at the tongue? Like what can you almost see right away? I know that might be a complicated question, but
no, oh my God, I love the tongue. The more tongues I see, the more I love it. I know that sounds weird, but any acupuncturists out there are like, yay, like that big high five hands. And it's funny that you mentioned Ayurvedic also, but I'll get back to that. So the tongue, it's the one muscle that we can see, right? Without breaking our bones and having muscles sticking out. So,
yeah.
In a very nice way. And all the organs are connected with the tongue, which is pretty cool. So looking at the top of the tongue, as well as underneath the tongue. So on the top of the tongue, in the front is the heart. Right behind there is the lungs. On the sides are the liver and gallbladder. Then in the middle is the stomach and spleen, our digestion. And then behind that, we've got the bladder and the kidneys. And then, so it's all different things with, and then underneath we have these, it's called these sublingual veins. And when they're distended, it shows us stagnation, and it could show some pain. So whether it be some chi stagnation or blood stagnation, I can see that right there.
Interesting.
Yeah.
And that correlates to like musculoskeletal pain as well, or any like.
Yeah. It could be anything. It could be any sort of stagnation, any kind of pain if you see that there. And then also where along that vein it is it in the upper portion of the body, middle or lower portion of the body? So it really clues us in. The pulse is also connected with the organs. So when you think of microsystems within Chinese medicine, the ears are one, the hands are one, and the feet also. But the tongue as well, and the tongue just gives so much information. With a snapshot of it, I can know, is it an excess condition, a deficiency, which organ it is there dampness, is there, is it livery, is it spleen? So this is what's really interesting. When I ask people about stress, and if someone's really worried, a lot of times that's connected with digestion, and also the spleen is also, the tongue looks swollen, we call it, also has to do with digestion. And if someone's really worried, these tongues, like, they have the similar presentations, and it's interesting because then I'll work on their digestion, and then their worrying can decrease. And the same with if someone's very like livery, we call it. So at the size of the tongue will give me that information. And so if someone, let's say, has to have a glass of wine every night, I can tell, it's their liver. So if they do something like, for example, eat a lot of greens, because that helps to detox the liver, their reactions to things might be a little less irritable or a little less angry. And so that's just helping the liver along. They can still enjoy that glass of wine, no problem with that. So I just like to know, that's why I ask all these questions, because it gives me so much information. And being able to incorporate so many different types of medicine really helps. It's cool how they like intersect and have all these ways. And Ayurvedic medicine actually is how I got really introduced with everything. That was one of the first ones I learned about. I volunteered at the Open Center when I lived in Manhattan, when I was working at Med Naturopathic with a naturopathic doctor in the West Village, and I was volunteering my time to just learn more. By volunteering there, I don't know if they still have it, but you can get free classes for Ayurvedic medicine. And I remembered the practitioner there did my pulse diagnosis. And it was really interesting because he noticed my lungs. Like, he looked at me and he thought, I think he kind of like thinks you have an impression of someone. And then when he looked at felt my pulse, it's like he was looking into my soul. And he just changed. And I'll never forget it, because he said, you have I forget how he phrased it, but like a problem with my lungs. And I was like, I do? And then fast forward years later with naturopathic medicine, I did have a problem with my lungs. So it was like all full circle, but I remembered that diagnosis and how he was very concerned with me. And I was like, I'm fine. And so I was like, but I believed him. Like, I'm always a believer. When people give me little tidbits, I like to put pieces of whatever I've heard along the way. I'm sure you can relate to that. And the more you learn, the more you talk to people, it makes sense. So, so I think that's wonderful that way.
That is really cool. And so tell us a little bit about your journey with your lung issue, if you don't mind, and in the sense of what have you been able to notice the changes by taking a little bit more of these holistic approaches and kind of cleaning yourself inside and out?
Sure, yeah. So my lung condition was really interesting. Well, actually, so I had two chronic conditions, which didn't present themselves until I was in med school. So actually, I went to naturopathic medical school thinking, I'm healthy, but I had already had so many health conditions. I had a subclinical situation. So I'll explain. I would always go to the doctor for cold hands and feet. And I would just didn't feel, I was so cold, and the doctors, they look at my labs, you're fine. I was a teenager, you're young. I would always get that from doctors, you're healthy, you're young, nothing's wrong.
Or like Raynaud's, or just kind of like everybody has that. And
Raynaud's. They said you have poor circulation. I said, well, what do I do about that? There's nothing. That was always, have you had that also? Or
my hands and feet are always freezing too, and all my patients, they really don't appreciate cold hands, or I guess some do, but yeah, I've kind of just been told, like, it is what it is. It's common in women, and there's no answer, But I know, too, from just, like, the research I've done, I was like, I'm sure my digestive tract has to be better, my sleep pattern, it's all connected.
Well, so I'll share my story. I think that you'll find this interesting. So I had that, and so what was showing up on labs was there's something called anti-nuclear bodies, ANA is the lab test, and it was positive, but none of the other autoimmune markers were showing up. So lupus was actually what I had, but the lupus antibody wasn't showing up. So with conventional medicine, Raynaud's is what they call a diagnosis of exclusion. It means that there's no autoimmune condition present via antibodies, but ANA is a marker of an autoimmune condition. So just because they can't diagnose this doesn't mean, so with naturopathic medicine, this is where it's a different approach, because conventional medicine needs the diagnosis to come in to work, or they just do symptomatic care. You know, to kind of make you feel better. Well, so what the doctor said told me was get a boyfriend for the winter. As a teenager who didn't even, like, I was a young teenager, I was like, I don't even like boys at this time, like, that's not going to help me. So the ANA was positive without that antibody showing up. So I remember naturopathic medical school, and I was preceptoring with a doctor in Connecticut, and I was telling her my symptoms because they were all over the map. And I had just been to an MD, and he had said to me, your symptoms are all over. We like to see things in a box. We like to be able to put things into a nice box and figure out a diagnosis. You're healthy, you're fine. And that's what he said. Then he's like, you're healthy, you're fine. Meanwhile, I was all over the map with my symptoms. Yeah. Which was, I would always get that from people all the time. So this doctor, she listens to me, and within 5 minutes, she's like, I think you have lupus. Like, we were just chit-chatting one day, and I was like, you know, so diagnoses sometimes can be daunting, they can be scary, they can be frustrating, they can be paralyzing. So I remember being kind of in disbelief, and I didn't want to believe it. And I was like, no. And I was in naturopathic medical school, so I was like, oh, I'm gonna figure this out. But I never forgot she said that. Then I had another doctor in clinic say, I think you have lupus, but the antibody wasn't showing up. Then I had another doctor who said, let's do this specialized test that's going to show the range, and the antibody might show it. It was specialized, so sometimes the antibody does show up, even though it doesn't show up on conventional labs, but it shows a range of where lupus is. So it shows from -5 to 5. So even if the antibody isn't showing up, if you're in that 0 to -5 range, you're going to show up in that range. So -5 being like you don't have it, and -4 being like you're creeping up. So the worse you're feeling, and I was at -1. And I was feeling really bad at this point. I had, not only were my hands and feet so cold, even in the summer, but they were purple and white. Like I thought I was gonna get frostbite. Sometimes I just sat there and I'd have, you know, all the blankets around me, and nothing was warming me up. It's painful. I'm sure you can relate to it. And so then I did this test, and I was like, and so at that point, I knew all these doctors were right. And you know, when the first doctor told me, she told me that a year ago, so I wasted a year. But, you know, I had to go on my own journey to figure this out. But it was less than a month, and I did natural treatments. I did the anti-inflammatory diet, avoiding nightshades. I did some mind-body work. You also have to think about, why do most women have autoimmune conditions? Because of all the things that were, you know, think about just the fact of women fixing their hair, let's say, and putting on makeup, or, you know, just presenting yourself in whatever way that society deems that you should, or that you're kind of taught as a kid. You're kind of telling yourself you're not good enough, because an autoimmune condition is you're rejecting thyself. You know, your antibodies, you're literally rejecting your own tissues. So I went through, you know, this whole mind, like really, like, you know, going down the rabbit hole with this, and within a week, suddenly, and I had weird joint pain, really painful. Like I couldn't do my workouts. I was doing I was down to 3 pounds, and one arm was a little stronger than the other, and I was going to 5 pounds. Workouts were just really affected negatively.
And then you're thinking, is this a neurological condition? Is what else, or might, I guess you had the lupus at this point, but it's still scary.
It was scary because it was a weird pain. I couldn't describe it. Then my hand would get swollen when I'd wake up in the morning. I remember I started with my right hand, and then it would be my left hand. I'm like, why are my hands swelling up? And nobody knew, you know. So it's all these weird symptoms. The fatigue was crazy. By 3 o'clock every day, I would be down for the count. I couldn't even meet my friends out for dinner. And this was in med school, so I'd wake up early in the morning to front load my day, because I would have energy in the morning. But by 3 o'clock, I would I'd almost have to be home. I sort of kind of schedule any of my clinics like earlier in the day if that possible. Sometimes I just had to struggle through it, knowing I'd be tired, but I just had to make it through. So, and what else was going on? I had the cold, the joints. Yeah, and I just wasn't feeling good. Yeah, and then I developed IBS during it. I mean, digestion was, it was crazy, and that was very painful. So I did a few things for digestion while it was going on, and that helped it. But then with autoimmune conditions, it's reversing chronic inflammation. So that's what conventional medicine missed. So there's a lot that you can do. So even I'll know these telltale signs, so I specialize with autoimmune, but, as a naturopathic doctor, I treat everyone who, wants to be my patient, from infants to geriatrics, but I do, specialize, so I'm able to see, even before I see lab work, if someone's describing all these symptoms, I like to confirm it with the labs, but the labs don't necessarily have to tell me there's chronic inflammation. Let's get ahead of this, and we could do a lot even without the diagnosis. There's a lot that could be done, and people will feel relief while they're getting their labs done, and et cetera, et cetera. But and proper supplementation, so it was using everything that we've got in our toolbox with naturopathic doctors. So nutrition, lifestyle, and supplements, and doing that mind body component also was huge. But I felt like I had to go through that, and I'm able to help people and my patients that way. So I'm actually pretty grateful for it. But when it comes to autoimmune conditions, even though I reversed it, I still know, if I eat those nightshades all the time, or, I eat foods that are going to be inflammatory, I'm going to put myself at risk. So my symptom is I get a swollen hand. So if I'm bad, like 2 days in a row, particularly, is what will happen. Like, let's say for a weekend, sometimes this will present, and then on a Monday, I'll get a swollen hand. And then I'll know, okay, let's back it up, and then I'll take some, anti-inflammatory supplements, and I'll be really good to ward it off. So that's kind of how it works for me. But, not using toxic things in the hair. I had to clean up my makeup, everything that I used in my hair cleaning. It is. Yeah, someone's talking about having celiac disease. Yeah, the whole autoimmune cascade. It's just you reverse that chronic inflammation. You don't have to worry about all the symptoms because you're getting to the root cause, and then you can reverse it, and then you feel better.
There's another question. What are inflammatory supplements? I know
you're asking anti-inflammatory supplements.
Yes, that's what I'm sure they mean.
I think what
anti-inflammatory. Like, I know turmeric and ginger, and I've had patients who have taken that, but obviously I know it's person by person. But what do you typically recommend, or for other anti-inflammatories?
Yeah, we got you there. She's like, sorry.
Yeah.
I think that's Sharon. I think that's Sharon. So ironically, with myself, are you familiar with omega-3s and omega-6s?
I feel like as most people have heard of them, yes, but as for the nitty-gritty.
So I'll give a little information about that. So I actually had tested my omega-3s and omega-6s. So at that time, so I'm now vegan, so whole food plant-based. But at the time, I had a pescatarian diet. So I ate a lot of seafood, which did cause, I got mercury toxicity. And I also had aluminum toxicity because I was cooking with aluminum. I used to think, like, how do these things happen? But that, was that able to manifest because I had this chronic inflammation? It's a whole picture thing. But I had done tests, and my omega-3s were so high. So omega-3s are the anti-inflammatory omega fats, and omega-6s are the inflammatory omega fats, okay? So omega-3s being anti-inflammatory, omega-6s being inflammatory, but still, it's not like omega-6s are bad. You want them all in balance. So you want a proper ratio of omega-3s and omega-6s. But my omega-3s were so high, my omega-6s were so low. So taking an omega-3 wasn't going to help me, and I was. So I actually had to stop taking an omega-3, which is interesting because most people will be like, just take omega-3s, but get tested, see what's going on, especially if you are a pescatarian and you eat a lot of seafood. That's something to think about. So anti-inflammatory supplements depend on the person. That's why I tell the story. But turmeric can also, then sometimes I will do something called genetic testing if necessary, because if there's a case that sometimes we get stuck on, or let's say they've tried everything else and blah, blah, blah. but turmeric can actually be inflammatory for some people. So what I'll ask, and typically turmeric is in the family of ginger, so I'll just simply say, do you like ginger? Is that a food that appeals to you? And then if it is, then, you know, I'll look into turmeric. Getting a quality supplement. You always want to make sure your supplements are quality. So we, in our dispensary, they're always third-party tested to make sure that they're high quality. But I always tell my patients, bring in the supplements. Or now in telehealth, I'm looking at the supplements, and they show me in the video, and I love to read, you know, what they're made of, what's in the capsules, all the ingredients in it, because there's certain things that, you know, I've been trained to look for, and that every day I'm still learning something a little bit new about stuff. But you want to make sure it's a quality supplement. But tons of things. So bromelain, boswellia is also really great if people like that. But also you have to think about what else is contributing to the inflammation. So there's so many, like quercetin. Sometimes, you know, and if you're deficient in anything, vitamin D helps, you know, when you take that, and that can help calm down the inflammation. So if you're low in vitamin D, you know, that's going to be a problem. So it's not just, oh, what's anti-inflammatory and let me take that. It's also taking out what could be causing the inflammation. So I always use nutrition. First off, because if they're eating inflammatory foods, that's just contributing to the problem. Absolutely. No matter what type of supplements you're taking, you're still putting fuel on the fire. So I just want to make it clear, it's not all about the supplements. There's so much to consider and think about. And when you think about stress, also, in fact, I'm doing a webinar this Thursday about stress and gut health. Because if you have a stressful lifestyle, whether it be work, family, or friends, or, you know, whatever's going on, that's a really inflammatory situation. So again, no matter what supplements you're taking, if you're super stressed out, and are you stressed out because you're not sleeping, you're low in melatonin, or your cortisol is low, and you really have to address the cortisol, then that could then help to decrease the stress, and then that would be the anti-inflammatory way to approach the inflammation.
Absolutely.
So,
and I've noticed
the answer, but
so
much think about.
Absolutely. And that's why it's like taking the time with patients to see the whole picture, because to get like, okay, well, you're also stressed about this at home, you are eating this, you know, have XYZ going on with your lab work if it's done. And so, you know, I feel like diet is so unique for people, and finding what works is also a trial and error factor.
I think so. Sharon's asking again. No, what I was mentioning was anti-inflammatory. So we're talking about supplements that are anti-inflammatory. But with the turmeric, I was saying that with some people with genetics, they can have a genetic disposition, and turmeric can act. And this is a very small population, but that's where with some people who are taking a lot of turmeric, and let's say their inflammation is getting worse, and or they're doing everything else, and the turmeric isn't helping, then perhaps they might have this genetic disposition where turmeric can actually be inflammatory. And I don't have off the top of my head what that marker is. But again, it's not all about genetics. It's actually about epigenetics. So that's why, you know, it's so important to empower everyone to take health into their own hands, because when you make proper choices with nutrition and lifestyle and supplements, you get the chronic inflammation under control. Then you don't turn on those bad genes. So, you know, sometimes that's, you know, when it comes down to the genetic testing, and that could be very stressful for people, knowing that they have a certain genetic disposition to a certain disease can be really stressful. But there's so much that you can do to make these choices with epigenetics, which are all the lifestyle choices and all the foods you choose to put in your mouth and all the drinks you choose to eat. And all the good supplements you choose to take, and all of the good thoughts that you put into your body. Those are all ways to keep yourself healthy, you know, and have a great microbiome. You know, we want to be in a position where, with the coronavirus and everything going around, you know, it's not the virus per se to be affected by. It's how we adapt to it,
and the stress of it, and the uncertainty. Someone just wrote what is genetic predisposition, and so I guess in more layman's terms, that's kind of what your body, your natural genes. And so if you're predisposed, it's, you know, like alcoholism, let's say, just because if it runs in your family, if there's a predisposition, does not mean you're guaranteed to be an alcoholic. It's more so like if you continue to do unhealthy lifestyle choices and factors, it could more likely turn on the gene or to develop a condition of some sort. And like you were saying, the epigenetics, those are the lifestyle choices to help keep your quote unquote bad genes at bay so that you don't turn on diseases, chronic conditions, cancer, etc. And there was another question, or what are the most common foods that people eat that cause increased inflammation in the body?
Oh, great question. Great question. So dairy being one of them. Oh my
I've
God.
had that issue. That's 7
Yeah,
years ago.
Yeah, and and it's this cycle where dairy actually has a factor where it connects to opioid receptors, which is really interesting. So
you get this like pain relief or
like pain relief. Yeah, yeah. So when someone has when someone eats, let's say they're feeling pain, whether it be emotional or physical, and dairy also, we grew up on it. I don't know how many of us, I know that we had milk all the time. My mom was always going to Dairy Barn to get more gallons of milk.
Every night at dinner, we had a glass of milk, like growing up.
Yeah. Yeah. And, so it becomes addictive, and you have this craving for it, you have these memories of eating it, and it kind of is, but when you think about it, it's really damp and heavy, and it ends up creating more pain in the body, and it's really inflammatory. So it's inflammatory on the gut, it's inflammatory where it can cause excess mucus and phlegm also, cause a lot of nasal congestion. It's a major factor, when it comes to proper respiratory health, so breaking up that mucus, but if you're gonna have dairy, that's just compounding the problem. But it also has a lot of issues within the gut, as well as gluten. So any kind of processed carbs as well. I'll just throw that in there because it's beyond gluten, because it's a processed carb. It's basically the body sees that as sugar, and sugar is also a major inflammatory substance. So it's a lot of these foods that are in the standard American diet, but pretty much. So I'll explain it like this. So the gut has these tight junctions in it. When you eat these inflammatory foods, what happens is that, if you've heard of leaky gut out there, this is what I'm talking about. So when you have these inflammatory foods, or have that chronic inflammation, and the inflammatory foods are making it worse, slowly these little gap junctions open up. So you see these little gaps in it. That's not what you want. But this is why leaky gut's happening. And then the proteins in the food, so you're looking at whey and casein and dairy, gliadin, that's in gluten. These proteins then come out of the gut lining wall, and then they're in the bloodstream, wreaking havoc. And everyone presents different when it comes to inflammation. So some people might have extreme headaches. They might have dysbiosis in the gut. It affects them there. Beyond the headaches, they might even have depression and anxiety, brain fog. They might end up with skin rashes. So the skin being our largest organ, directly connected with gut health. You clean up the gut, you take away the inflammation, and the skin can clear up. Because the skin, think about it, when it's red and rashy, that's an expression of heat. So if there's inflammation going on in the gut, the body wants to get rid of it. And if you're, if that's where it's going to end up, is your skin. So everyone reacts differently with it. And, or it could be, with autoimmune, you could just be tired. So that's the same thing. When I see people that are tired and they go, yeah, I've been tired forever. And they're just used to it. But for a naturopathic doctor, it's like my antennas are up because there's some kind of imbalance in the body. So we need to figure out what that is so that you can get your energy back. Because we want to be able to thrive in this world. We don't just want to be surviving, and rolling out of bed and, it's
barely
like
getting by.
Yeah, you want to have excitement and, something new and, and really, really thrive and enjoy your life.
Yeah. And I see that too with a lot of patients of my own who are just like, I've had this pain forever, it is what it is. And it's like, no, it doesn't have to be that way. Just like you don't have to be tired forever. There are ways to get better. And there's no magic pill like we would all like, and we want the quick fix, but that's unrealistic. But it's like, you don't have to suffer. And, it just takes time, it takes effort, it takes consistency. By no means is it easy, but it is 100% possible. And when people actually, take the steps to finally do it, and they're like, as soon as that like aha moment goes off, or they feel the difference, it's just incredible.
Yeah, and people will get stuck. People have these deep-rooted connections with food. So having these conversations, sometimes I have to approach it very delicately, and slowly. So people enjoy the food. Sometimes they don't make these connections. So educating and explaining to people how this works is definitely a part of what I have to do. And I love to do it. But I love if people are listening to these talks so that they can hear about it. And because, in order to make these changes, you have to figure it out for yourself. Just because someone's telling you what you should do doesn't mean that you've literally or figuratively digested this information and you're ready to do that, to make that change. And I know that that's part of it. It was kind of like I had to have 3 doctors tell me that I had lupus before I finally got the tests to figure out, oh, I do in fact have this. And then I was making those changes, because what was I doing? I was making my own homemade tomato sauce every day because it was something easy to do for school, and I can throw it on top of food. And it was, and so I was doing that weekly. Every Sunday I would make homemade tomato sauce, like a big container of it. And then tomato nightshade. So
I was going to say, I heard too with tomatoes, you think they're a healthy plant, you grow them in your garden, but they do actually upset a lot of people's digestive tract. Could you explain a bit more why? Or why it might upset certain?
For that reasoning, so it depends as a nightshade, so it's tomatoes, eggplants, white potatoes, and peppers. And there's more in the family of nightshades, but those are the main culprits. So if there is chronic inflammation going on, looking at that and then trying to remove that from the diet. So this is very difficult for some people. Tomatoes might be the one thing. I see that a lot that people do not want to remove. So if your ANA is positive, if you have an autoimmune condition, it could be in your thyroid, it could be celiac, it could, whatever it is, eating those nightshades, particularly if it's tomatoes, that could be causing the inflammation there. And there's also thinking about having food that's organic and non-GMO is so important also. So those pesticides, if you're eating the tomatoes with the skins on them, you're still ingesting all those pesticides, which are not good for our digestive system at all. And I think that that's downplayed because it's so tough to get organic and non-GMO, but it's so important to do that. I was just at a conference, The Real Truth About Health. They have it on every January, at the end of January, at the Melville Hilton. It's a 10-day free conference. It's amazing. And one of the doctors up there was talking about, they did a study, it was 145 couples. 100% of the couples were able to get pregnant. Now, they didn't follow them through the pregnancy, but they got pregnant. That was just the point of the study. And the one change that they made was for both the female and the male to eat organic and non-GMO foods. That was the one change. And they all were able to get pregnant, which just, it has so much to support and say for that factor that our food is so important and for it not to be contaminated and it to be quality. So for people to really understand how important that is, because think of how much people are paying, for fertility treatments. And oh my gosh, you can just pay a little extra for really good food. On top of that, your body benefits in so many wonderful ways. And that's what will be wonderful. Some people will say to me sometimes, oh, doc, my elbow hurts. How can you help me? And it's like, well, let's find out why the elbow is hurting, because I bet you're just going to feel better in so many different ways. And I couldn't even possibly figure out how that's going to work for you, because I get the feedback from patients. Oh yeah, I just had my energy back, and I get to enjoy time with my grandchildren now, or et cetera, et cetera. It just opens this world of the wonderful life that you could be having, because when you're in pain, you're really suffering.
And it's hard to get out of that cycle, because then if you physically don't feel good, mentally don't feel good, and then to put forth the energy to make those changes can be a very tough hurdle for people.
Yes.
But it's like once you finally make that breakthrough and you start feeling good, it can really the momentum just takes off. I had a patient, she had a meniscus surgery, and so I was, treating her knee, and she just decided, I'm just going to go vegan. I think, I can't remember her whole history, but she might have had RA, she might have had just a history of at least back pain. And she said 2 weeks into the diet, not only did she feel like she was just getting stronger, with the exercise program for her knee rehab, but her husband mentioned to her, he's like, you haven't complained about your back once and she goes, oh my gosh. And she felt incredible too, you know, and she was just responding a lot faster, healing a lot faster, getting back, you know, her normal, you know, strength and walking better, and, you know, other benefits were just happening around the body without intentionally doing so.
Yeah. Yeah. So speaking about anti-inflammatory, whole food plant-based diet, the world of veggies is the most anti-inflammatory option one can make for themselves, because meat and dairy are extremely inflammatory. And then think about also the protein load. So when you think about meat and dairy, even seafood, so eating that protein, you know, we're in this world where it's all about protein, 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 protein. But we're missing the boat again, because it's all about balance. So it's, you know, when they had the low fat diet, so we really missed the boat there, because you need good fats. It's green, right? And then doing the low carb diet, and then no one has energy. We realize that we need good carbs, right? We don't need the breads. That was true, but we do need good carbs. And now with the, we need high protein. Now everyone's eating too much protein. We think about that also. What's in the protein? Growth hormones. So what does growth hormones do? It makes you grow. So now we have obesity problems. What does it also make you grow? You have benign or malignant tumors. Those are growths also. You know, because there's growth factors that are in these foods. So encouraging people to have these high protein diet of those sources is really not the right information that people are getting out there. So having the world of veggies, which has plenty of protein in it. So we're thinking about maintaining, you know, as humans, for the most part, everyone's trying to maintain. And you get that by having a whole food plant-based diet with all the right amount of protein, carbs, and fats are just right in there. So you don't have to worry about eating more, you know, but again, people are, you know, that can be a tough point with people if people aren't willing to make those changes. But I have to explain to them to let them know, because just like you were saying, there's so many stories. People suddenly, they're able to lose weight, they're able to do all these, you know, they're feeling better in just all these ways that they didn't think were possible by eating vegetables. So it's wonderful.
I too have gone more plant-based in recent years, and I read Anti-Cancer New Way of Life, and so that too, of like what you can do instead and what toxins you're being exposed to without even realizing. Though I have also heard out there of like certain, I guess, research or studies saying, and other providers, I guess, of some animal protein is okay. Or I guess if you're eating the non-hormone, non-GMO like animals, then I'm sure we're still within a small enough portion, not excess, actually does help certain cellular factors. And I can't
there's
be
a lot
specific.
of research out there that would say something else. But if somebody does, you know, they want their meat, you know, as a naturopathic doctor, I have to meet them where they're at, you know, so I understand that. So of course, but you know, you're still there's growth factors. So no matter how well raised these animals have, no matter what beautiful life they have and massaging the cows and everything for the water, it doesn't matter.
Okay.
You know, I do meet my patients where they're at, so there are some options. You know, I have a little Chihuahua, and I get her the best food, you know, meat that I can out there. I go to, you know, where it's you know, organically, and you know, just, you know, they have lovely lives, hopefully, you know, but you don't really know unless it's your own farm and you're dealing with the animals yourself. You really just don't know, unfortunately. So, and I'm a big animal lover, so I actually stopped eating meat early 9 years ago, actually, just because of the way I feel so bad for the animals. So that's how it started for me. But then now I understand all the nutrition aspects for it. And then with osteoporosis, what they show is that especially, you know, with women, but all vegans, you know, if you're vegan earlier in your lifetime, actually you maintain your bone mineral density. So
that's interesting.
So yes, it might spike for those who eat meat. It might spike, but those who have had a vegan diet, it actually maintains. So there's no drop off when you get older. In fact, Brenda Davis, she's a registered dietitian who I know, and when she got tested in her 60s, she forget how it was, she's 61. God, she looks like she's 30, to be honest. So I always forget. But she was saying when she got tested, her bone mineral density, she was like off the charts because it was so high that women in her age range are never that high. And she provides many studies.
Wow. So she was 30 on the bone density.
She was on this call. She would literally say the studies. She'd know the statistics. She's like amazing in that sense. She's broke. But so if you're ever interested, follow her information. She makes the most delicious meals. Like she lives the lifestyle and wonderfully, with really delicious foods, and she's posting about it, and I love to follow her. So yeah, so that's another benefit also. There's so many, wonderful benefits, but only if someone's open to that. I'm not going to make a choice if it's not for them, so it's important that I'm always meeting patients where they're at, but I think it's always an important conversation to have because people aren't really thinking about that or even considering that an option. Oh, I can just have vegetables and
thrive.
And actually, yeah, you're going to feel really wonderful if you do, and you're going to get the results that you want. But if they're not willing to do that, then, I always have tools in my toolbox to be able to help them, and heal them. And then I think I never answered your question with the pulmonary disease. Okay. So that happened a couple years after my lupus, and I was working out. So I did have you ever done Orange Theory fitness classes?
No, not actually, no, but yes, I've heard and seen it more online than anything.
Yeah, so I tried it out, and it was fantastic. But so what I learned from that, so I only did like a little what I got, like a free week pass or something like that, and do these inclines. And so I typically don't do treadmill. It's just I love strength training. But anyways, and if I do the bike. If I just don't like the impact or whatever. But I did the treadmill. They did this incline. You think that you're like climbing Mount Everest on this incline. So I would do it, and then I go to my other gym. The week's over. I go back to my other gym, and I was like, oh yeah, before my strength training, I was like, let me do that high incline treadmill workout. Within 30 seconds, I'll never forget. It was a cold day. And I did this workout, and within 30 seconds, I had to bring it down because I thought I was going to fall off the treadmill. I had this cold sensation in my sternum, and it was lodged, and it wouldn't go. I had this shortness of breath, and I was like, what just happened? What is this?
And you're young, you're fit,
I'm rubbing this spot, and I'm trying to get the cold. I just remember it was so cold, I just wanted to warm it up. So I remember going like this, and I'm like massaging it, and I had the shortness of breath, and it lasted for 2 days. So it was nothing where I put myself in the emergency room, but I knew I felt discomfort. And I was like, what had just happened to me? By the time I got to so when you have shortness of breath, you go to 2 doctors, cardiologist for the heart, pulmonologist for the lungs. So I booked my both appointments. Cardiologist I got in first. And he said, you're fine. He's like, you're fine. You're young and healthy. And I made him run an EKG and echo because he didn't want to. But I was like, please. So he did that. You have to ask for it. So I'm a big advocate for my patients. Like, ask for this, and this is why you need to ask for it. And I think that's an important part. It's important to have all these doctors work together, have a good team on your side.
Yes.
And then I went to the pulmonologist, and he's listening to my lungs. Your lungs sound fine. By this point, I didn't have the shortness of breath when I saw the doctors. So they're looking at me like, why are you here? I'm sitting in the waiting room. Everyone had oxygen tanks, like really, really, sick on the, I felt awful. I remember sitting there going, do I belong here? But I knew I did. I said, there's something wrong with me.
Yeah.
So, well, you could do a pulmonary function test. Do you want to do that? He was kind of like, take it or leave it. I was like, yes, absolutely. I need answers. So I did this test. I don't know if you've ever done a pulmonary function.
My dad's had one, so I've watched it done. Yeah.
So you're in this like capsule. I thought I was like, going to Mars or something like that. And I remember it was so difficult. So I thought the machine was broken. I said, you don't have enough oxygen. Whatever you're trying to do in here, it's not working. The woman's checking everything. Lo and behold, the doctor calls my results and says, you have mild obstructive lung disease. And I said, well, and I knew in medical school, I'd heard of a treatment for, COPD and inflammatory lung disease. And I said, well, what can I do? And he said, nothing. He said, you'll probably get COPD. So you can go every year and get tested. And I was like, I wasn't a smoker. My dad did smoke when I grew up, though. So I was exposed to secondhand smoke. But I said to him, I said, well, what about inhaled glutathione? I know that I've read studies about this. I know that that's a treatment for this. He wasn't familiar with it. So, with all due respect, he wasn't familiar with it, but he wasn't open to it. It wasn't part of his medicine. So I said, okay, you thank them for the results and you go on your way. So I ordered a nebulizer on Amazon. I got inhaled glutathione. I got it from a sterile compound pharmacy, and I did the treatment. I did it twice a day for 5 months. And then I went to my pulmonologist here in Huntington, who was young and savvy, and he knew about the treatment I had done, which was nice. It's nice to have a doctor who understands what you're going through.
So that's more of a natural inhaler, or anybody could get that? It's not prescription based, or?
Nope. prescription. So I had to get an integrative medical doctor
Okay.
prescribe it for me. So it was one of the doctors that I knew, and he wrote the script for me.
Okay.
And I got it from a compound pharmacy that was that shipped it to me.
Nice.
I had to pay out of pocket. So
I was going to say, since you say you go on Amazon, you get an inhaler. Like...
Yeah, I got the nebulizer. I got the nebulizer.
Yeah.
You know, well, I asked the pulmonologist. I asked him for a nebulizer. I said, "Oh, can you give me a script for a nebulizer?" And he wouldn't. He said yes, but only if you get albuterol with it. And I said, no, I'll be honest, that's not what I'm using it for. I'm using it for inhaled glutathione. So so I just paid out about the nebulizers were cheap. It was like $30 on Amazon.
Yeah.
No problem. I got it. I did the treatment. And I remember the first time I did the treatment, I go, oh, this is how you're supposed to breathe. I didn't know for probably most of my life I had this, that I wasn't breathing properly. And then, so it goes back to that Ayurvedic doctor, I then knew what he meant when he realized that lung pulse was off.
Very interesting.
I was like, oh, I wish I could go back to him and be like, feel my lungs now.
Yeah.
So yeah, like talk about full circle stuff. And so yeah, so that was great.
Which is incredible.
And now I'm so grateful now because with all the, when it comes to chronic inflammation, if you have any inflammatory lung disease, it's a real problem now because if you get coronavirus, that's where the infection lodges, in our respiratory tract. So I'm so grateful that I reversed this years ago, which is why I encourage people to get to the root cause of any ailments you have. Like, you see, mine were all really mild, but they were building up.
Yes.
And got them fixed, and they reversed fairly quickly. But, there are people out there who are just suffering and they're on maybe medications for decades and just not reversing it, just staying copacetic, but that's not what you want. You want true healing so that you can feel great and feel better and get your life back. And then also, who would even think that we'd be in a pandemic right now where it could be life or death? So really getting any chronic disease under control sooner than later and reversing it if possible. And you could do that with natural medicine is important. Yeah.
Absolutely. I think we have a little under 10 minutes left, but another question is, do you know about pandas and kids?
Yeah.
What is that? Because I'm not even sure.
Yeah, so I'm not an expert in that to talk about that. I do work with pediatrics. I can definitely, if that viewer there wants to message me, I can direct you to doctors that do specialize in pediatrics with children, but I don't want to say anything or give any misinformation about that. But yes, I am familiar with it, but I can definitely send you on to someone who can talk about it. You're welcome. Yeah, just DM me and I'll send you to the experts in that. But there's a lot with children. Understanding, again, it's not just treating that diagnosis. It's also treating the person, and understanding that. So even two people can have the same diagnosis, but it's different ways to treat them. So understanding what deficiencies that they have going on, and homeopathy can be really effective. So especially with children, homeopathy, they tend to respond really well with that. And but in addition to nutrition and lifestyle and supplements and taking out a lot of inflammatory offenders is a great approach with dealing with something like Pandas and other conditions with children. Yeah.
What about like seasonal allergies? Do you find that mitigates people who are symptomatic around this time? Usually, even without COVID.
Yeah. Well, yeah. So allergies, you go back to dairy. So you go back to the inflammation and the congestion and all that. I mean, people with allergies, by taking the dairy out, people are like, oh, I'm not, my asthma is really under control. Oh, my allergies, I'm not affected this season like I was affected. But you have to look at heavy metals. Like, there's so many things to think about, regarding that. So.
I experienced acupuncture for the first time a few months ago, and she was talking about kinesiology, which is different than what we learn as PTs. That's the physics of the body, the forces upon the joints. And she was talking, with more the energy aspect of it and how, whether you've had a previous disease or sickness, and that's housing itself in the thyroid, in the brain, the heavy metals toxicity, maybe your mother or grandmother had, let's say, polio, and that might show up even though you've never had that, but just how stuff gets passed down and kind of stored. And so it was very interesting to learn about, again, clearing that energy, clearing those toxins, and being able to kind of reset the whole system.
Yeah, 100%. Yeah. Yeah, and think about that energy and storing it. Have you ever read the book, It's Not All About You?
I think that's on my reading list. I haven't gotten to it yet.
Oh, okay. Yeah, so it's about, it's so interesting. I remember this guy in Connecticut, I went to this little coffee shop all the time, and he owned the restaurant, and just one day he looked at me and he goes, I have a book for you, and he came back in, and so I read it within days, and it's about tracing back energetically how it's passed down in our genes, he talks about in the book 3 generations worth of ailments, but of actual physical conditions, that we can inherit, which is really interesting.
But It's All About You, you're saying, is a great book to read, and
it's not just about, what is it? It's not just about you. I might be getting it wrong. It's something like that. You can DM me and I'll, I have it lying around, or no, I gave it back to that guy, but it's not just about you. So, yeah, because it's beyond ourselves, when you think about that. So it's interesting. Yeah, yeah, it could be really, there's many ways to approach healing, and health and bringing the body back to balance. So.
Yeah. Now, does anybody have any final questions in the group that you want to ask on? We'll see if anybody, we'll give them a minute. This has all been great and super informative. Again, I love it.
In here, thank you.
Yeah. No, and I feel.
We're neighbors. You're not
too
far.
Exactly. Well, I don't see any other questions. Do you have any final statements or messages you want to send to everybody?
Yeah, just, I hope that this sheds some light. So if a lot of people don't know about naturopathic medicine, but there are naturopathic doctors, New York, we're here in New York and Long Island. There's not a lot of us, but here I am. And Inner Source Health is a great practice. NAC, yeah, so NAC is N-acetylcysteine. It's the precursor to glutathione. Glutathione is a tripeptide made up of 3 amino acids there, and cysteine being one of them. And NAC is a powerful mucolytic, so breaking up the mucus. So when it comes to respiratory health, it's been a real powerhouse during this time. A lot of people are taking it. I've used it to even detox heavy metals. It's been wonderful. It's a powerful detoxer, and it's a powerful antioxidant. So glutathione is one of the most powerful antioxidants in the body, and NAC provides that. So when you take NAC, your body then produces glutathione, which is wonderful. Anything about 500 milligrams or so, even about 600 or 900 milligrams, sometimes people say. And quercetin is great. Yeah, great mast cell stabilizer, and taking that together, if someone's having any allergic symptoms, quercetin can do that to stabilize those mast cells. And it also is powerful anti-inflammatory. There's a supplement called BCQ, which includes quercetin, and I often like to use that. So, yeah.
Awesome.
Yeah, and just, knowing that natural medicine and naturopathic medicine can really help. We work in conjunction with other providers. So if you want a great team on your hands, I'm always willing to reach out to your provider, explain how our health plans are, what I'm planning for you with these health plans, and how it can work, to use it. Yeah, that could be great for kids. Sharon, also there's other supplements. There's a DHIS Junior that I'd like to use with children who have allergies. So yeah, there's plenty of options, to help with that. Yeah. Right. So thank you for giving me a platform to be able to talk about the medicine that I love. I really enjoyed it.
No, I could tell you're super passionate. This was great, and again, very informative. And I'm, excited to see more providers out there just truly helping their patients, empowering them, and allowing them to be the best advocate for themselves.
Yes. Awesome.
All right. You're welcome. Well, you stay safe, and
yeah, you too.
I'll talk to you soon.
Okay. Bye now.
Bye.